Good day everyone, and for today's video is I'm going to perform the return demonstration on medical hand washing. What is medical hand washing? It deters the spread of microorganisms. Hand hygiene is very much important because it is the way to prevent the transmission of microorganisms via the route of transmission. It is the most important in preventing nosocomial or hospital-acquired infections. These are the following equipments that is needed in medical hand washing. First is we have the gel hand soap or bar soap. We have also the sink with running water. There is also a lotion, but it is optional. We have also the towel. We have also the tissue paper, the containers, and the trash can. Assemble all the needed equipment. Stand in front of the sink. Do not allow your uniforms to touch the sink during the washing procedure. Because the sink is considered contaminated, uniforms may carry microorganisms. Next is we have to remove all the jewelries. Removing of jewelries harbor microorganisms. Next is we have to turn on the water and adjust the force. Water splashed from contaminated sink will contaminate your uniform. Next is we have to wet the hands from the wrist area, pointing fingers toward the bottom of the sink. Water should flow from the cleaner area toward the more contaminated area. Hands are more contaminated than forearms. Use bar soap or liquid soap, lather thoroughly with bar soap. Rinse the bar soap and return the soap dish. Rinsing the soap removes the lather that contain microorganisms. Turn off the water faucet and discard the use of tissue. This prevents the nurse from picking up microorganisms from the faucet handle. Rub hands briskly, starting palm, ensure formation of the latter during the process. Rubbing motion and creating foam out of a soap help loosen dirt or the hands. Next is we have to place the right palm over the left dorsum, interface fingers rubbing briskly. Then, left palm over the right dorsum. This is the friction caused by firm rubbing, and rotational motion helps to loosen dirt and microorganisms that can lodge between fingers and skin, crevices of knuckles and palms, and back of the hands as well as the wrist and forearms. Palm to palm with fingers interlace. Next, back of the fingers to opposing palm with fingers interlock. Rotational rubbing of the left thumb by chasing it in and the right palm and the vice versa. Circular rubbing forward and backward with clasped fingers, including thumb of right hand in the left palm and the vice versa. We have next is the rotational rubbing of forearm, starting above the wrist going up to the elbow. The contamination of the hands extend until forearms depending on the activities the person engages with. Length of hand washing is determined by the degree of contamination. Use brush or fingernails of the other hand to clean other fingernails of the other hand. That is, the organism can lodge and remain under the nails where they can grow and be spread to others. Next is we have to open the faucet with tissue paper. This prevents the nurse from picking up microorganisms from the faucet from the handle. Rinse thoroughly with wrist pointed upward. Visually inspect for remaining dirt or soap. Running water rinses the organism and the dirt into the sink are considered cleaner. Turn off faucet with the use of tissue paper towels. This prevents the nurse from picking up the microorganism from the faucet handle. Dry hands and grease with towels. Drying the skin. Drying the skin will prevent scalping. The next is we have to use the lotion on hands if desired, because lotion will help to keep the skin soft. Then do aftercare after the procedure, and that is the medical hand washing. Thank you for watching.